Hi, welcome to Springer Nature Trade Sales' Q4 2022 Clinical Medical Titles presentation. These are our key titles nominated by our sales and editorial team for their high sales potential, and also highlights and books we're excited to introduce to you for October through December. So without further ado, we will kick off our presentation. And our first title here from the anesthesiology discipline is the Airway Manual. The Airway Manual provides up-to-date and easy-to-understand information on airway management with exclusive focus on practical management along with the required theory background and key points. Some things to know: it covers all techniques of airway management like the use of video laryngoscopy, fiber optic intubation, and retrograde intubation. The book also includes a chapter on airway management during transmittable infectious diseases. Most recently, COVID-19 is something we all know about. Separate chapters on the available guidelines, discussion of interesting cases, neonatal airway, and out-of-hospital airway management are also included. This book, with all of its content, is a useful resource for postgrad students, residents, and fellows in anesthesiology, emergency medicine, critical care medicine, and for anesthesiologists, intensivists, emergency physicians. This book is also very relevant for them as well. Our next title here is Clinical Decision-Making in Oral Medicine. This is the first of our dentistry list that we will present to you. To accurately diagnose the myriad of diseases that can affect the mouth, guide patients correctly, and offer treatment with competence is a permanent challenge for dental surgeons and health professionals. Clinical decision-making in oral medicine guides health professionals in the diagnoses and treatment of oral and maxillofacial diseases. Each chapter begins with a summary of the topic, a brief description of the main diseases that fall into the diagnostic category, and their main definitions. Then, clinical characteristics, ways of making diagnoses, and a protocol for treatment are also presented in the book. This is a very concise book. Most of the chapters have no more than 5 pages, and they all follow the same format to standardized use, so it should be a quick and easy guide to use. This book targets health professionals and physicians from various specialties who are interested in the disease with systemic repercussions that affect the oral and maxillofacial complex, and in oral repercussions of treatment for complex diseases such as head and neck cancer. And our next title here is Surgically Facilitated Orthodontic Therapy. This guide is intended to help practitioners involved in dental interdisciplinary therapy or are managing complex cases. It demonstrates the next level of collaboration through managing core problems of the patients and planning cases using digital dentistry for the enhanced, close, and more ideal outcome. Methods for regaining space appropriation, dental alveolar bone engineering are also illustrated in the book, and emphasis is placed on corticotomy-assisted orthodontic therapy and 3D planning to help practitioners to achieve outcomes that were previously unrecognized. This book is a great resource for periodontists, oral and maxillofacial surgeons, orthodontists, and restorative clinicians who are interested in the subject. And our next title is Androgenetic Alopecia from A to Z. Volume 2 is on drugs, herbs, nutrition, and supplements. This is the second of a 3 related volumes set. It's designed as a reference tool for understanding and treatment of androgenetic alopecia and female pattern hair loss. This book fills a gap in the latest literature. The volume includes a thorough review of lifestyle and nutritional factors that can affect androgenetic alopecia and female pattern hair loss. Symptoms include excessive caloric intake, high-fat diets, caloric deprivation, alcohol abuse, and smoking. The book also covers every aspect of medical, non-surgical, and non-invasive, and nutritional treatment options and its clinical effects. FDA-approved hair growth drugs, experimental drugs, hormones, and popular fraudulent controversial products are all presented with figures, tables, algorithms, and thousands of fully updated and balanced literature citations. This book will be an invaluable reference for dermatologists and all clinical practitioners dealing with androgenetic alopecia and female pattern hair loss, and will help them answer challenging patient questions, debunk myths on hair growth drugs and supplement, and navigate patients toward effective and safe treatments. The Atlas of Dermatologic Diseases and Solid Organ Transplant Recipients. This book presents the most important dermatosis in solid organ transplant recipients. So the number of solid organ transplant recipients is increasing worldwide every year, which has meant a significant improvement of recipients' survival and quality of life. To prevent graft rejections, patients require long-term immunosuppression, which is responsible for their increased risk of neoplastic and infectious diseases. Providing a guide to diagnosis and appropriate therapy, this atlas will help dermatologists, general practitioners, and physicians manage the dermatoses found in organ transplant recipients. Our next title in dermatology is Atopic Dermatitis Eczema. This is an entirely revised second edition that presents the latest research, clinics, and practical management of atopic dermatitis eczema. The dramatic rise in the prevalence of this disease over the last few decades is reflected by detailed analysis and epidemiological data from all over the world. The book shares insights on research and clinical practice, including in-depth descriptions of key pathophysiological mechanisms, including epidermal barrier, molecular genetics, itch pathophysiology, and modern cellular immunology. It also covers treatment and management, both topical and systemic, of eczema, the role of the microbiome and antimicrobial treatments, dietary recommendations for individuals with food allergies, and explores psychosocial aspects of the disease as well. Environmental influences are also considered with regard to irritants and allergens of eczema, and all recommendations are based on current national and international guidelines. So this is a fully revised edition and will be an invaluable asset for dermatologists, allergists, pediatricians, general practitioners, but also for all related health professionals, personnel, and patient organizations interested in gaining a fuller understanding of the widespread skin disease. And our last title in dermatology here is Dermatology in Public Health Environments. This is the first reference resource on the interface between dermatology and public health. It combines practical content and evidence-based practices in various areas of dermatology, including teaching. Dermatological diseases are extremely common around the globe, and a systemic understanding of these conditions and their relationships with various epidemiological factors could provide insights to help governments and private institutions address the challenges they need to overcome in order to improve global health. This extensively revised second edition comprehensively discusses the fundamental areas of dermatological practice in public health. Topics include the profile of dermatological care and on epidemiological concepts, the most significant skin disease, including dermatology in tropical medicine, the relationship between the environment and dermatological diseases, dermatosis in the human life cycle, and diseases that are not primarily dermatological but have a high impact on public health. All said, the book is a valuable reference for undergraduate and graduate students, dermatologists, and general practitioners, as well as anyone interested in the relationship between dermatology and public health. This is the last of the dermatology titles, so I will hand it over to Madeline to present our books in gynecology.
All right. First, we have Gynecological Endoscopic Surgery, which is a textbook that embraces most aspects of gynecological laparoscopy and hysteroscopy and aims to present a comprehensive coverage of gynecological minimal access surgeries with excellent medical illustrations. The book covers the history of minimal access surgery, instrumentation, and ergonomics required to progress in the field. And in addition, it describes the latest technological advancements in the field backed with high current best evidence. The authors are practicing specialists drawn from 5 continents with a wide range of expertise, and the textbook targets a global audience of practicing and trainee doctors in general gynecology, subspecialists, and those with relevant interests in gynecological endoscopy surgery. Next, we have Topographic Labioplasty, which provides the reader a fully descriptive approach of labioplasty, specifically labia minora hypertrophy and clitoral hood elongation. The expert contributors present their technique of topographic labioplasty that allows the surgeon to improve surgical results and avoid complications and poor aesthetic outcomes. It also enables surgeons to understand the huge anatomical variance related to labia minora hypertrophy and clitoral frenulum complex. The 18 chapters include a brief historical research about the history of labioplasty, indications and contraindications for the surgery, and aesthetic considerations, surgical instrumentation, reconstructive aspects, labioplasty in teenagers, and the sexological impact. Topographic labioplasty is addressed to consultants in gynecology, plastic surgery, urogynecology, and those interested in female cosmetic genital surgery. Next, we have Health Information Systems. This is a heavily revised open access edition, which provides a thorough overview of the technologies available to assemble, manage, and assess the quality of health information systems. It details a variety of scenarios in the context of both health and healthcare, including where prevention and wellness are related, such as the treatment of both acute and chronic diseases. It's a vital resource for medical informatics students seeking an up-to-date text on the topic. Next, we have Artificial Intelligence in PET-CT on Oncologic Imaging, which presents artificial intelligence applications that may help in detecting disease, defining tissue characterization, meaning benign versus malignant, staging, and correlation with molecular biomarkers. Originally positioned as a means for non-invasive molecular phenotyping and quantification in the 1970s, PET's technological improvements in the 2000s generated renewed interests in quantification, which has grown a lot over the last 5 years. This progress is parallel with the development of artificial intelligence systems for oncology, which aim at providing the best possible treatments to patients suffering from lung, breast, brain, prostate, liver, and other types of cancer. The chapters provide an overview of the use of AI and PET-CT imaging for various types of cancer, and it will be an invaluable tool, especially for nuclear medicine physicians and oncologists. Functional Neuroradiology is also a new edition, which fully updates and expands Farrow and Mohammed's Functional Neuroradiology, which is a gold standard, a comprehensive introduction to the state-of-the-art functional imaging in neuroradiology. With chapters written by internationally distinguished neuroradiologists, neurologists, psychiatrists, cognitive neuroscientists, and physicists, functional neuroradiology is divided into 12 major sections. This second edition is fully updated throughout and includes more than 15 new chapters on topics such as brain tumor, radiogenomics, CNS tumor surveillance, and functional MR perfusion imaging, as well as additional topics. By offering readers a complete overview of functional imaging modalities and techniques currently used in patient diagnosis and management, as well as emerging technology, functional neuroradiology is a vital information source for physicians and cognitive neuroscientists involved in daily practice and research. Next is Imaging and Pathology of Pancreatic Neoplasms. This is a second edition, and this atlas focuses on imaging methods and techniques, new diagnostic concepts and therapeutic approaches in management of pancreatic neoplasms. Although interest in pancreatic pathology is very high in the radiological and gastroenterological communities, less is known about it than other topics like liver pathology. Diagnosis depends on the structure of the pancreatic lesion, which can be directly visualized in US, CT, or MR images. The book focuses on imaging and pathological appearances, with most of the text concentrated at the beginning of the book, followed by an images gallery with high-quality images to help in identification. A comprehensive overview is provided of typical and atypical presentations and diverse aspects of common and rare pancreatic tumors. Given its scope, this atlas will be an invaluable asset, helping radiologists understand the underlying pathology and helping pancreatic pathologists understand the imaging translation. Next is Imaging in Geriatrics. This book addresses in a structured and multidisciplinary way the medical issues related to aging, paying particular attention to the role of diagnostic imaging in the field of cardiovascular, musculoskeletal, respiratory, neurological, urogenital, and gastrointestinal diseases. The progressive increase of the average age of the population, of life expectancy, and the improvement of the quality of life are common phenomena in many countries of the world, making the topics in this book widely relevant. Medicine in all its branches has in fact focused more and more on the health conditions of the elderly patient and their protection. And in this context, due to the increasing progress in the field of technology and imaging methods, the radiologist occupies a frontline position. The aim of this book is to provide the radiologist with an adequate preparation to treat geriatric patients and to improve the diagnostic therapeutic management of those patients who constitute the largest part of medical health users. I'll pass it back to Jenny.
All right, thank you. Okay, over to me with EEG FMRI. This is the second edition of a highly successful book that provides the most up-to-date and comprehensive source of information on all aspects of EEG fMRI. The acronym stands for Electroencephalography and Functional Magnetic Resonance Imaging. This second edition offers 5 entirely new chapters covering important areas of research that have emerged during the past 5 years, including non-invasive brain stimulation during fMRI, resting state functional connectivity, real-time fMRI, and neurofeedback. The reader will find in-depth information on physiological principles of the EEG and fMRI signals, practical aspects of data measurement, artifact reduction, data analysis, and its applications. This book will be valuable for neuroradiologists, neuroscientists, physicists, engineers, electrophysiologists, medical students, medical students, and medical scientists, neurologists, and neurophysiologists. Okay. And over to our next title in neurosurgery. So, brain anatomy and brain anatomy and neurosurgical approaches. This book joins the classical brain anatomy to the challenges of neurosurgery approaches. Its 30 illustrated chapters connect basic concepts to the specialist experience in the operating room. The authors provide tips and tricks for accessing the brain into the surface, the cisterns, central core, ventricles, and skull base. The brain anatomy and neurosurgical approaches is focused on neurosurgeons in training and those who need updated information and technical tips on how to deal with neurosurgical patients, as well as anatomical challenges in real surgeries. A neurosurgeon's residents and students will have a helpful source of study and research with this book. The main volume editor is a key opinion leader in the field. He is chief editor of the official Brazilian Neurosurgery Journal, the president of the Brazilian Neurosurgical Society, and he is an associate member of Harvard Medical School and Harvard University alumna since 2015. The next title we have is A Guide to Mechanical Circulatory Support. This is a unique book that details a multidisciplinary approach for providing care for the mechanical circulatory support patient. The authors discuss the history of MCS, patient selection, surgical and postoperative care, mobility and nutritional issues for this subgroup of patients, along with outpatient management. Non-clinical issues included are regulatory, reimbursement, administration, program development, and links to professional organizations supporting MCS clinicians that are in the field. A guide to mechanical circulatory support will be of great value to nurses first, but also to advanced practice providers such as nurse practitioners and physician assistants. Dietitians, physical therapists, and administrators will also find this helpful. The authors are expert clinicians in the field of MCS who provide direct patient care, conduct research, publish, and maintain current leadership positions within the International Society of Heart and Lung Transplants and the International Consortium of Circulatory Assistant Clinicians. Our next title is Guide for Advanced Nursing Care of the Adult with Congenital Heart Disease. Over the past 50 years, advances in surgical techniques and medical therapies have drastically improved the number of congenital heart disease patients that do survive into adulthood, with the result being that there are now more adults than children living with congenital heart disease. In the past 3 decades, recognition of this new cardiology subspecialty has given way to formalized programs, standards of care, and multidisciplinary expertise. Nursing care of adult patients with congenital heart disease is a relatively new medical subspecialty with limited knowledge and guidance available, and also an important component of the multidisciplinary care team. The aim of this book is to provide one central resource for nurses who are seeking expert guidance for caring for adults with congenital heart disease. So this book does aim to introduce nursing-focused care to a wider audience, but also to nurses, medical technicians, and physicians who are involved in the management and treatment of ACHD patients, otherwise known as adult congenital heart disease patients. And the next title we have is an open access book, How Can We Use Simulation to Improve Competencies in Nursing? This book offers an overview of theories related to simulation and illustrates how simulation may be used in different levels of professional education. The book explains the role of the simulation facilitator, peer learning, and the use of virtual reality in education and learning. It is intended to help and guide teachers in nursing and other healthcare professionals who have an interest in the use of active learning methods. The next title we have is The Resident's Guide to Shoulder and Elbow Surgery. Utilizing a practical high-yield presentation, The Resident's Guide to Shoulder and Elbow Surgery is a comprehensive review of the most common shoulder and elbow diagnoses and management strategies. It allows easy access to pertinent information for residents and fellows while preparing for rounds, the clinic, and the operating room, and also aids residents studying for their yearly in-training exam. Each topic is organized in a consistent bulleted format so that the information flows in a logical manner. History, physical examination, imaging, when and what to order, the most appropriate treatment algorithm, non-operative and operative, and the risks and complications of surgical intervention do follow in that logical format. There is currently no textbook on shoulder and elbows tailored specifically for orthopedic residents, fellows, and senior medical students. So this should be a really helpful guide for anyone who is looking for that much needed research for their early career as a clinician or surgeon. Okay, and now back to Madeline for the next round of our key titles.
All right, so next we have Regenerative Medicine. This book explores the rapidly growing subspecialty of regenerative medicine and pain management. It provides concise guidelines and instruction for healthcare providers interested in implementing this novel therapy. The book contains 3 sections and begins with a thorough introduction to the field. Section 1 examines various therapies such as stem cell collection, allograft therapies, and bone marrow aspirations. Section 2 then delves into the medical diagnosis and procedural guidance methods, including ultrasound imaging, endoscopy, local anesthetics, and anticoagulation medications. Section 3 concludes the book with numerous discussions on standardized treatment paradigms. A unique first-of-its-kind book, Regenerative Medicine seeks to inspire medical practitioners to integrate this subspecialty into pain management therapies and treatments. Next, we have Atlas of Major Thoracoscopic Pediatric Lung Resection for Congenital Pulmonary Airway Malformation. This atlas offers a step-by-step approach to thoracoscopic surgery for congenital pulmonary malformation, known as CPAM, and each major lung resection. This technique is still a matter of debate and is still used approximately by 50% of surgeons in Europe. It's a challenging procedure since operating on children's lungs is a much more delicate and precise operation, and because the pulmonary malformations treated by this procedure are quite rare, making this technique difficult to learn and reproduce. The volume, which is the result of surgical experience acquired since 2007 in this field, offers a step-by-step approach to the procedure in each major lung resection and is illustrated by numerous photos, short video clips, and even complete resection videos. Tips and tricks are presented to facilitate surgery to make it reproducible and accessible to all surgeons, whether they are young surgeons in training or experienced ones. This atlas offers an essential guide for practitioners, trainees, and thoracoscopic surgeons. Next, we have core techniques in flap reconstructive microsurgery. This book provides a practical step-by-step guide on modern workhorse flaps, meaning the practice of using living skin tissue to reconstruct skin tissue during surgery or after injury for plastic and reconstructive surgeons in training or in their early career. The 50 chapters cover everything from surgical fundamentals to preconditions of microsurgical techniques, but also cover preoperative planning, the steps of microsurgical dissection and management of complications in a straightforward explanatory style, and it's supplemented by over 600 clinical illustrations and images. Further video demonstrations with pertinent steps in flap dissection, anatomical nomenclature, and long-term outcomes are also demonstrated. For each flap, a detailed discussion of key papers concerning its origin, pitfalls, technical refinements, and tips for success are also included. Thanks to specific notes on common reconstructive challenges and complications, this book offers a valuable reference tool and would be an integral reference guide for every surgeon interested in reconstructive microsurgical techniques, especially during their early career. Next, we have Perennial Reconstruction. This book presents a comprehensive overview of all available surgical techniques for complex perennial reconstruction. Divided into 17 chapters and employing a multidisciplinary approach, it provides valuable insights into the resectional aspects of this field, considerations in multiple organ removal, such as bladder, anus, and colon in stomach, and the inclusion of radiology and preoperative planning for complex reconstructions, as well as anesthetic aspects in perioperative patient care. Written by leading experts in the field, the respective chapters offer step-by-step descriptions of all available reconstructive options and detailed information on perennial and pelvic defects, together with valuable insights into surgical executions, indications, and common complications and pitfalls encountered when dealing with this challenging defect. Given its breadth of coverage, the book provides a practical and comprehensive guide for consultant plastic and reconstructive surgeons and for surgeons of allied specialties involved in resectional aspects of perennial and pelvic surgery. Next, we have Digital Mental Health. This innovative book focuses on potential, limitations, and recommendations for the digital mental health landscape. Authors synthesize existing literature on the validity of digital health technologies, including smartphone apps, sensors, chatbots, and telepsychiatry for mental health disorders. They also note that collecting real-time biological information is usually better than collecting filled-in forms. And they address how to mitigate problems related to recall bias in clinical appointments. Limitations such as confidentiality, engagement, and retention rates are also discussed. Digital mental health will help clinicians and researchers, especially psychiatrics and psychologists, to define measures and to determine how to test apps for usefulness, feasibility, and efficiency in order to develop a consensus about their reliability. These professionals will be armed with the latest evidence as well as prepared for a new age of treating mental health. Fundamentals of Psychiatry for Healthcare Professionals. This book provides all the relevant information to understand mental illness through psychopathology, global clinical manifestations, and clinical patterns. It equips the reader with the basic knowledge to identify psychiatric conditions occurring alone or in the context of other medical illnesses, to distinguish health psychology and psychiatry, and to know what to do, how to do it, and how to communicate with the patient and to cooperate with the psychiatrist. The core chapters are dedicated to mental disorders, and the work also includes a general chapter on psychopathology and one on psychopharmacology, presenting the practical information about suggested doses, side effects, drug interactions, and warnings for the main psychotropics. The final chapter deals with forensics and legal aspects also. The book will appeal to a wide readership from postgraduate professionals who want to broaden their clinical knowledge of psychiatry to medical students and students of health degree courses like physiotherapy, psychology, and nursing. Next, we have Frontiers of COVID-19. This book aims to serve the critical interests of the global community by supplying the most current knowledge and understanding of COVID-19 epidemiology, treatment, and prognoses. There was much uncertain and contradictory information published in the first year of the novel coronavirus, as we all know. The dynamics of COVID-19 have now been realized, though, including the type of antibodies produced in infected patients and their limited lasting endurance. This book will set the record straight on the concept of herd immunity and explore the current vaccine trials taking place in different countries. Comprehensive book will illuminate recent advances regarding COVID-19 and offer a possible roadmap on how to move forward. This will be a vital and forward-looking guide for infectious disease clinicians, scientists, and researchers, as well as students at the graduate level.
Okay.
And now back to Jenny.
Thanks, Madeline. All right. Our next title is Exercise and Physical Activity During Pregnancy and Postpartum. This is the second edition of a very well-received, practice-oriented, multidisciplinary book that fills the gap between evidence-based knowledge on the benefits of physical activity and exercise during pregnancy and postpartum, and the implementation of exercise programs and related health promotions measures in pregnant women. So the book aims to allay undue fears regarding the consequence of exercise during pregnancies. The author equips readers with the latest guidelines and detailed descriptions of exercise testing, prescription, selection, and adaptation for pregnant and postpartum women, including those that have clinical conditions. Additionally, readers will find up-to-date evidence on the psychological, social, physiological, body composition, musculoskeletal, and biomechanical changes that occur during pregnancy and their implications for physical activity and exercise. Our next title is The Atlas of Orthopedic Surgical Approaches to the Lower Limbs, combining clear visual information with a consistent and concise structure, including tips, tricks, and pitfalls. This atlas presents all of the most used approaches in orthopedic prosthetic surgery and traumatology. Ranging from the hip to the ankle, each chapter includes a clear presentation of the joint's anatomy with particular emphasis on vessels, nerves, and other relevant anatomic structures. This atlas offers a timely and up-to-date resource for both practicing and fellow orthopedic surgeons that have an interest in lower limb surgery. And our title, Manual of Spine Surgery. This is the second edition and has been compiled in response to the rapid expansion of instrumented spinal surgery using minimally invasive and non-fusion techniques. The second edition takes full account of the latest developments in spinal instrumentation and implants, as well as new surgical techniques. The various open, less invasive, and minimally invasive techniques are presented step by step in a clear and instructive way with the aid of more than 600 high-quality illustrations. So this is a highly visual book. Careful attention is paid to all aspects vital to the success of any spinal operation, including, but not limited to, precise definition of indications and contraindications, the technical and organizational factors, good operating technique, and correct preoperative preparation and positioning of the patient. It is an authoritative, concise, and portable book, so this is ideal for use in a fast-paced clinical setting and will serve as a daily companion for spinal surgeons and others who do care for patients with spinal disorders. And that is the last of our clinical medicine titles. Here are some trade highlights in medicine from Springer Nature. And we have here Managing Your Mental Health During Your PhD. This is best summed up as a PhD survival guide. It investigates why mental health issues are so common among among the postgraduate population, but goes beyond statistics and actually examines the lived experience of pursuing one's doctorate. The author does not shy away from personal anecdotes and candidly discusses what she wished she had known at the start of her PhD process. Key themes discussed include managing imposter syndrome, environmental influences, systemic biases, prioritizing workload, and self-care strategies to deal with the pressures of academic rigor. Our next title here is Drugs Easily Explained. It addresses the billions of people worldwide who take medications to treat diseases, but also those who take those medicines and lack the common knowledge of why the drug should be taken, how the drug works, and what side effects to expect. The internet is brimming with information, but accessing it can be overwhelming, and doctors and pharmacists often don't have or take the time to ensure their patients understand the interaction between drugs and disease. So this book is free of jargon and presents a clear overview of the most common diseases and the drugs used to treat them. The last title on this slide is Exercise and the Brain. So the brain needs physical exercise both for normal health and for preventing and treating diseases common with aging. Exercise in the Brain focuses on the benefits of exercise for prevention and treatment of chronic brain disorders. It is a guide for finding the right exercise routine for each individual. And the goal of this book is to show the reader why everyone needs to exercise, get moving, especially as we get older. And calm and confident under stress. Well, stress is familiar to almost everyone, and I'm sure that we all experienced it in the past couple of years. But many do suffer from the negative consequences of constant stress, something that we don't know that much about. Calm and Confident Under Stress shares a variety of possible courses of action and it encourages readers to find their own way to a calm and healthy way of dealing with stress at work and in everyday life. It is written for stress sufferers as a self-help guide and as a comprehensible accompanying guide for professionals in the context of consultation. And our last title for today is Curiosity in Medicine. This collection of 80 short stories inspires curiosity and provides a detailed look, a very fascinating look, at the history of medicine. It investigates many topics, including ancient Egyptian knowledge of the field, the fundamental importance of toothache and how it birthed anesthesia, why and when women were allowed to run marathons, and also includes historically important biographies such as those of Arthur Conan Doyle, Napoleon Bonaparte, and Claude Monet. A lot more interesting short stories here also include the background on rubber gloves, the stethoscope, and the intraocular lens. So this book is relevant for anyone who is interested in the history of medicine. And that is our medical title presentation for today. We are so happy you joined us, and we would like to just say if you have any questions or want to see our books, please contact us here, Jenny Liu or Madeline Corbin at springernature.com. Thank you for your time.